Namaskar, welcome to PK's classes. Today we are going to study about the necrosis. Necrosis is a type of cell death characterized by edema, dissolution of nuclear chromatin, swelling of organelles like endoplasmic reticulum and mitochondria, disruption of the plasma membrane, which leads to release of intracellular contents into the extracellular space, and all this results in inflammation. So necrosis is associated with inflammation, and this occurs due to the breakdown of the plasma membrane and release of the intracellular contents, and there is also swelling of endoplasmic reticulum and mitochondria, and there is amorphous densities in mitochondria, and initially there can be recovery, so that is reversible injury, but when it leads to membrane damage, then it becomes irreversible, and it leads to necrosis or cell death. So the causes and the risk factors include the toxins or chemicals, number one. Number two, lack of blood and oxygen supply to the tissues. When there is lack of blood supply, we call it as ischemia. And when there is lack of oxygen supply, we call it as hypoxia. Then trauma or any physical injury. Then the chronic conditions which can impair blood flow leading to ischemia. Number five, the radiations, conditions like low temperature, and one of the important reasons, infections, mostly the bacteria infections. So these are the causes and risk factors. So the symptoms of necrosis, there will be redness of the skin, swelling or inflammation, and there will be pain, blisters, the pocket of fluid between upper layers of skin. So there will be edema or fluid collection, which causes the inflammation. Then there is skin discoloration, sensation, numbness, loss of sensation. So loss of sensation. So these are the symptoms. Then types, there can be at least 6 types of necrosis, and the most common form of necrosis is the coagulative necrosis caused by hypoxia or infection, and it affects the solid organs like heart, kidney and spleen. And you can see here in the spleen, this is the structure of a spleen, where this area you can see this is necrosis, and this is called coagulative necrosis. And you can see here this is the kidney, coagulative necrosis in the kidney. Histopathologically you can see like this. This is normal one and this is necrosis one. Then a type of coagulative necrosis, that is gaseous necrosis, and we can say that it is a combination of coagulative and liquefactive necrosis, where it looks like a cheese, So mostly in tuberculosis, the infectious lung disease tuberculosis, this type of necrosis occurs, and it appears cheesy white. So histopathologically it can be seen like this. So the second most common type of necrosis is the liquefactive necrosis, and we can call it as wet necrosis, and the coagulative necrosis as the dry necrosis. And mostly the brain is affected, the neurons and neuroglial cells are dead in this type of necrosis, So this is normal drain and this is liquefactive necrosis. So the difference between the coagulative necrosis and liquefactive necrosis is the tissue is solid and firm, and for example myocardial infarction, and the necrosis in spleen, necrosis in kidney. Whereas the dead cells undergo disintegration and affected tissue is liquefied in case of liquefactive necrosis, and the example is cerebral infarction. So you can see the histopathology of liquefactive necrosis. Then the fourth type is the fat necrosis, a condition in which fat cells are damaged and die, leading to the formation of hard lumps. And the main symptom is the painless lump or mass under the skin that is caused due to fat necrosis, and there is skin discoloration or redness, and mostly the fat tissues are affected, and the most common organ affected is the breast. Occasionally there may be drainage of oily or chalky fluid from that affected area. The causes may be trauma or pancreatitis, inflammation in the pancreas. Then the fifth type of necrosis is the fibrinoid necrosis, which affects the blood vessels like artery, and caused by deposition of immune complexes and fibrin in the walls of the blood vessels, and this leads to a circumferential bright pink area of necrosis, and there is presence of dark nuclei of neutrophils, and some of the examples are vasculitis, preeclampsia, polyarteritis nodosa. So these are some of the examples of fibrinoid necrosis. Then we'll discuss about the sixth type, the gangrenous necrosis, which affects mostly the extremities like the limbs, and you can see it can be of two types, dry or coagulative, and wet or liquefactive. So this is a dry or solid gangrene caused by a mass of solid tissue in this little toe, and you can see the black color appearance, shrunken, dry and black, and mostly it is caused by the bacterial infections, and this gangrene occurs due to loss of blood supply due to ischemia, and you can see here this is the normal one and this is the gangrene ones. So necrosis can be diagnosed by imaging techniques and biopsy, and necrosis, since it is a pathological condition, it has to be treated, and if it is reversible, then we can treat it by restoring the blood flow. For example, if it is ischemia, we can restore the blood flow, and if it is infection, we can use the antibiotics, and if it is severe one, we have to remove surgically. We have to remove the say toe or finger. We have to remove them surgically. And recently this necrosis is emerging as an important therapeutic tool for cancer treatment. So this is all about necrosis. Thank you.